temps in, you scan it as a pre-treatment scan with the temporaries in, and you get enough of the vestibule and the tissue on the other side so it knows how to digitally articulate it when the temps aren't there. Then you do a post-treatment scan with just the scan body.
We do the same thing basically.
Yeah.
When you have the temps. The issue is like right now we have a case.
Когда у нас нет темп.
Right. So we have a patient right now that we're doing the upper one. We're just opening him up with 4 implants, and but he has we did a temporary full upper for him.
Okay.
So there's not
Like a denture?
Yeah.
Or, okay.
So we didn't do the immediate load. We just did.
Got you. So you could still get it that way. What you do is you put the denture in and scan upper, lower, and bite with the denture in as the pre-treatment scan. Then you would go back in and scan the edentulous ridge. When you scan the denture in, you want to make sure and get tissue around it. Get the vestibule, or get,
I understand.
because it will use that when the denture's not in to digitally articulate it. And it would be the same, I think they have a denture case in here. This one's just a copy of a denture. You also need to scan the denture outside the mouth, which with this, it's very easy. With this one, it's very hard. Have you ever tried to scan a denture
Well,
outside?
no, we're not doing it with this. We have trios, the 3 shape we have. So
Okay.
we do 3 shape with the, and it scans it pretty good. The newer one, we
Yeah.
have the 5.
Yeah, so this is an all-NX case, and they scan the denture outside of the mouth. And then you would also scan the edentulous ridge and get that data to the lab in like a separate scan, and the lab will be able to put it all together.
So you can scan the denture, the upper denture, the bite, and then scan the edentulous, and they can basically put the denture into edentulous and have the bite.
Yeah, digitally in like exocad they could do that. As long as they have the copy of the denture, this scan, they have the edentulous ridge, and in the mouth you have this to get the bite. You would scan in the mouth like this, and it will tell you the vertical of it.
Correct.
And then they can just pick a couple points on the denture and the edentulous ridge to match it up. Or what you could do is, when you're doing the scan in the mouth, make sure to get,
But very often you can't do that.
if you get tissue right here,
Yeah.
or on the lingual side, like,
It's impossible.
yeah,
It's always-
it's always full of acrylic.
But you're saying if you do this, if you do the scan of the denture, scan of the edentulous, and then give them the bite, they'll be able to transfer it.
Yes.
Okay, so then that'll work.
And if you go on YouTube and look up Itero denture scanning workflow, it walks you through the whole procedure in an actual patient with a doctor scanning it.
Can
And
you send me a link?
yeah, so I didn't even think that this would scan. A prosthodontist gave me this a couple weeks ago because she has this one and she has difficulty scanning partials and dentures outside the mouth.
Impossible.
So she gave me this denture. She's like, I have a denture for you to scan with this to put it to the test. But it was all shiny metal both sides. That's why I didn't think it was gonna work. Look at the scan.
Sick. That's better than the other one.
Yeah. And it was like 5 minutes that it did it. 6 minutes. Scan that whole thing outside the mouth. Perfect.
It doesn't stop you when the image gets too big?
No. The Trios has that. The Itero.
It doesn't stop you, but it starts blinking
Yeah.
reddish. Like you
Yeah,
do
there's like a
3,000
counter.
Correct.
It
Yeah.
keeps going up as longer you
Yeah,
scan.
yeah.
Yeah, the Itero has no limit. It may take longer to process it and send it to the lab, but it's not going to stop you from having too much data.
And all we have to do is just get this exchanged, right?
Yeah, the other side of it too is now when you are looking at like if you're showing a new patient that you scan them for a wellness scan to talk about their issues, the scan images are photorealistic now. So the scans are much more clear than on this one. This one, like if you pull up let's pull up a scan from this week.
Засвеченный какой-то.
They're clear in their color, but it's still a little fuzzy, You see the difference?
она перегружать, если количество картинок,
No,
просто что он
я
тормозит
спросил его.
сам, нет, сам сканер не во время сканирования, а в целом. Просто вот она со временем набирает какие-то, я не
Oh,
знаю,
okay, so like a catch here, where it should be cleared once in a while for it to work faster?
This is basically your cache. I think the way that you're scanning is probably what was making it a little. If you go here and you have
вот мне надо вручную все
so
удалять.
this in progress, you see how it says scanning, scanning, scanning? Think of this box as an open window on a laptop. You know, if you open up 15 windows on your laptop, it's not going to work as fast. These are all open windows on your laptop. So you always want to clear those.
And how do you do that? You press,
Just hit it and hit delete. Just make sure you don't need any of those.
Yeah.
That's how you clear it. You can also call support and have them log in remotely and they can mess around with it, but I haven't seen that really, unless there's like major issues with it stalling, that it's really not needed. Just keep that free of.
and that should do it.
Yeah, and you know the scanning path. You saw how fast it went when I did it. How they taught us to do it. It's all about how it stitches it together. Because if you go, it doesn't know where to keep scanning if you go too fast or you go in a different protocol than the machine
Versus
is.
with this where you don't care.
This one doesn't care, but this one is a great scanner. It just has to follow. It's quicker if you follow that occlusal, lingual, buccal, buccal.
Okay.
And the other cool thing is, let me go back to this scan I was doing.
Надо Фукса тоже проверить.
To get the bite is a little different
I
too.
don't know his login.
Там ведь записано. Я потом проверю.
So you know how with this one, when you get the bite, you have to put it on there,
Mhm.
and then you got to go in a zigzag until it
Mhm.
articulates it. With this one, so I did the upper to get the bite. All you really need to do is put it in, retract their cheek with the wand, get about a centimeter of space between the teeth and the wand, and hold it there, and you see the white ghost of the wand on the screen? You see how much more data it collected than the size of this? That's that wide field of view. So all you really need to do is just hold it there, and it will see enough data to grab the bite. So the bite's a little easier than, sometimes you really gotta mess with it on that one and get it up and down and come forward too far. This will give you good data too, because the bite is best from like not past the canines. You wanna keep it,
The molar region.
yeah, in the molar region. So if you just, I mean, it's scanned basically,
In one shot.
and yeah, without moving it, you know. So we've sold, like, when they announced